Good morning, one and all. I am Dr. Mayur Pawashe. I welcome all the participants who have joined the proceedings of Azadi ka Amrit Mahotsav from all over the country. Today is the day 2 of 7-day celebration. The day is scheduled to host 2 webinars on diverse topics. On that note, our first speaker for the day is Dr. Shirish Upadhye, Director, Wildlife Research and Training Center, Gorewada, Nagpur. His topic is of an extremely important discussion on tiger conservation and veterinary interventions, SWOT analysis. It is an honor and privilege to introduce Dr. Shirish Upadhye, an accomplished and seasoned surgeon with vast experience of more than 28 years. He is a passionate wildlife veterinarian who made his way to become youngest director of Wildlife Research and Training Center, Nagpur, through relentless preservation, perseverance, and hard work. He understands the need for an efficient healthcare platform to cater the challenging needs of the wildlife and has accomplished to build a center of excellence in wild animal health care by providing prompt healthcare services. He is well-known face among us wildlife veterinarian and is recognized for his works in conservation and management of wildlife health in India. He is one of the founder members of the team who conceptualized the establishment of WRTC at Nagpur that has paved way for all-round development in the field of wildlife conservation in the state. To his credit, he has won many awards and recognitions. To name a few, he is a recipient of ICAR Junior Research Fellowship Award and Senior Research Fellowship Award of CSIR New Delhi. He is also a recipient of prestigious Nakul Award, Pillars of Hindustani Society Award, Swaminathan Iyer Award. He has more than 15 gold medals of Indian Society of Veterinary Surgery and many more societies. He has been felicitated thrice by the Department of Forest, Government of Maharashtra for his contribution in wildlife health management. He has more than 150 research publications in national and international journals and has co-authored 3 books of wildlife. Presently, he is working as Director of Wildlife Research and Training Center, Gorewada, Nagpur. He has vast experience in dealing with wildlife diseases, capture of free-ranging tigers, leopards in Maharashtra, and mortality investigations beside managing wild animals in distress. He has provided expertise in the field of wildlife conservation through inputs in situ and ex situ conservation programs, rehabilitation, and diagnostics. He has worked at Maharashtra Zoo as zoo in charge and co-officer in charge for more than 5 years. He is a member of state level committee formed by the university for advising the State Department regarding wildlife health management and also the committee to release and rehabilitate tigers formed by the Forest Department. We are honored to have you, sir. I welcome Dr. Shirish Upadhye for his talk on tiger conservation and veterinary interventions, SWOT analysis. Over to you, sir, for your talk, please.
Thank you, Dr. Mayur. Good morning. I welcome all participants who have joined us online for this webinar. Today, I wish to discuss the strength, weakness, opportunity, and threats in feline conservation, tiger conservation rather, from our veterinary perspective. As we know, the tigers are the majestic species with cultural and aesthetic value. Besides India, other countries such as Malaysia and Bangladesh also regard this beast as the national animal. The species has always been a symbol of strength and dominance in India. Unfortunately, out of the 8 subspecies of tigers, the last 3, that is the China, the South China, Caspian, and the Caspian, Java, and Bali, these are now under hunted to extinction. If we consider our country, India is home for more than 70% of the tigers of the world. The current standing, as per 2018 census, we have 2,967 tigers, and the Project Tiger has been an important landmark in conservation of tigers in India. In whooping $153 billion allotted for the conservation efforts. So we are now having a pride that we have the majority of the tiger population. Now, if we consider the mortality, next slide please. If we consider the mortality and mortality pattern in tiger deaths, most of the tiger deaths are because of intra-species aggression, 66.7%, then interspecies aggression, cub mortality, then in unnatural causes, we have poaching, accidents, legal eliminations, and diseases. Now, the things which we have, I have highlighted with a red font, these are the points where veterinarian can intervene and we have a say in these things. Next, please. Now, veterinary intervention in wildlife conservation. We have been talking about the veterinary intervention in so many webinars, conferences, symposium, and we all veterinarians are putting forth our efforts in wildlife conservation. At Wildlife Research and Training Center, when we consider the role of veterinarians, we consider the concept of 6 R's of wildlife conservation. That is the rescue, remedy, rehabilitation, reintroduction or release of these animals, the research and reach or the extension work. Next, please. The Wildlife Research and Training Center Nagpur has been engaged in healthcare and management of wildlife through rescue, treatment, release, diagnosis. We are doing hand rearing, research, and of course instructions to the students of veterinary colleges of MAPSU. So this is an important facet added in wildlife conservation. I remember the days when I was a student of BVSC and AH. My batch, that is 2090, I recollect. It was the first batch wherein the internship was introduced in veterinary syllabus. Subsequently, thankfully, the Veterinary Council of India has now increased the participation of veterinary students in wildlife education. So it is added as a course. Still, I feel it is little insufficient. Now, when we talk about conservation, training of field veterinarians is also being focused at WRTC. Yesterday, Dr. Parag Nigam in his webinar has elaborated the role of veterinarians in rescue and rehabilitation quite sufficiently. Somebody yesterday was also rightly talking about the need to strengthen the cadre of wildlife veterinarian in forest reserves. In Maharashtra, we are attempting this, and establishment of WRTC is, I feel, is a major step in this direction. Now, this Wildlife Research and Training Center Gorewada Nagpur is established through a memorandum of understanding between Maharashtra Animal and Fisheries Sciences University and Forest Development Corporation Limited Nagpur. And this is located in Gorewada Rescue Center premises. And by establishing such a center, both the stakeholders of conservation, that is Forest Department as well as veterinary institutions, universities, they are in win-win situation. The Forest Department gets quick treatment for animals, and we can also undertake research and capacity building in activities in wildlife. So as I said, this is the beginning of WRTC in 2015. We formulated or we signed an MOU, and the model works on the basis that MAPSU provides the technical manpower and their remuneration or salaries, whereas FDCM Limited provides for facilities for recurring and non-recurring expenditure. Next, please. So these are the glimpses of activities which we are doing at WRTC Nagpur. Next, please. The staff position, I'm thankful to the government of Maharashtra for providing the sufficient staff for the WRTC. It has a total 20 posts, which includes veterinarians, research fellows, lab technicians, and support staff. In the time to come, center will have a full-fledged center for care and rehabilitation of wildlife. We are already marching in a right direction. Next slide, please. We have good facilities at the center. We have a spacious operation theater, well equipped with hydraulic small animal as well as large animal hydraulic operation table. We have anesthesia machine. We have the radiography machine. This is a mobile radiography unit, first of its kind, can be taken to the enclosures directly, and it's a very good machine with digital facilities. We have ultrasound and color Doppler machine. We have a very good laboratory setup. Why I am stressing this is in wildlife field at zoos, we may have some of these facilities, but it's very unique that at a single place, we have all these facilities, and my fellow veterinarians will agree that time is very precious in treating the wild animals, and sending the sample outside, getting the results and then treating is a very difficult task. So we are really proud to have such a unique facilities at our laboratory. Next, please. So now with this background, I would like to discuss our topic in terms of different case studies which we have done. Saheb Rao, probably the whole India knows the tiger Saheb Rao. Here we have shared our experiences of treatment, rescue, rehabilitation, and from, of course, veterinary point. Just wait, please. I'll ask you to change the slide next, please. So this Saheb Rao, this is a celebrity of state of Maharashtra, and it was a victim of poaching attempt, wherein the tiger lost the digits because of the entrapment, and it developed the gangrene and resulting complications. So this was trapped in Chandrapur district, and then it was subsequently transferred for the further treatment in Nagpur. Initially, it was in the custody of Forest Department, subsequently Maharaj Bagh Zoo. Next, please. So Sahabra's life, although was saved from the snare, and this huge, it was 145 kg male tiger. It was rehabilitated at Maharaj Bagh Zoo in 2012 and then to the Gorewada Rescue Center. Subsequently, due to limping and using of the affected limb more, the tiger suffered arthritis and few more fractures in the digits and accompanied by intense pain and discomfort. Next, please. So this tiger was rehabilitated, but during rehabilitation, as I said, the usage of affected limb with two amputated digits and with heavy weight, it resulted in fractures and dislocations. The tiger showed signs of distress during the locomotion as well, and hence the team of veterinarians, we conducted radiographic examination of the tiger Sahebrao, and it was revealed that the remnant digits were affected. Hence, it was decided to perform the neurectomy, and we also thought of putting an artificial limb in this tiger. Next, please. So these are the glimpses of the procedure that was carried out at Gorewada Rescue Center. The pictures on the bottom row is the artificial limb. So this was the first probable attempt of putting an artificial limb to wild felid, and the expertise from human orthopedic surgeons also we had sought. Although this attempt was not successful, we have learned lessons from this as well, and we are still working for some better options. Next, please. So my point is, when Sahabra was trapped, you can see here on the picture at Gund Mohali. So you can see the route from where the tiger was transported, and this is the route for transfer from the site of poaching to veterinary care facility. I feel personally that there is a need for proper transport facilities for transport of ailing animals to the site of veterinary care, because during this period we lost precious time, and probably the digits which Sahab Rao had to lose during this entire procedure, shifting was a major time constraint, and ultimately it led to gangrene. Next, please. Sahab Rao during his course of journey also suffered from hepatorenal failure. Prompt medicinal intervention with hepatic and renal protecting medicines and use of protein-rich fibrin biological dressings helped in early recovery. And of course, during that period, WRTC was not established, but our entire team, Dakshit Sir, Dr. Bhojne, Dr. Dood, myself, Dr. Bavaskar, so we all were involved in saving this precious tiger, although he had to lose the digits, but he recovered well from hepatorenal failure. Next, please. So as I was saying, cages are majorly used for transport and treatment of tigers, and it is a crucial facility and needs modernization with time to ensure ease of operation. A typical unloading and release operation looks like this. We have again devised, of course, every zoo is attempting for safe and smooth the transport of animals, because this is again a chance for making more injuries to the animals. I think Dr. Parag Nigam also spoke about this in his yesterday's webinar. Next, please. Now at WRTC and Gorewada Rescue Center, we have tried to improve the cages model to treat wildlife, especially the tiger species. The cage to the extreme left is a manual squeeze cage, whereas you can in the middle of it is a hydraulic cage, so it can be operated from a safer distance and with quite ease with mechanical pumping. And last one you can see on the extreme right is a automated hydraulic squeeze cage with motor enabling operations. So these are making us the operations very easy when we are intervening or treating the animals. Next, please. So these are the lessons learned in Sahabrao case. I think better logistic facility for transportation of wildlife in distress is very important. So also is the expert rapid response team for tranquilization of tigers in the field. Fortunately, we have very good team in Maharashtra in the field also. Besides WRTC in the field, Dr. Khobragade is there, Dr. Chetan, then Dubey, all are involved. Dr. Kholkute, he is online, so he also has contributed a lot. And rapid response team, we have a very good team in Nagpur and Maharashtra. and prompt response to alleviation of pain and suffering is equally important, and need of sophisticated equipments, including the prosthesis, if it is to be done. Next, please. As I said, cages are very important. So improved cages are news highlighted. This is a news highlighting the transport operation undertaken by WRTC Nagpur. We have now transport vehicles, good team and SOPs for transport of animals. During last December only, we could shift nearly 45 wild animals, including tiger, leopard, sloth bear, and even herbivores, to the newly established Mahotsav Thackeray International Zoological Park, Gorewada, within a span of a week, without any casualties or any untowards happening, without any injuries to the animals. Next, please. Then this is another case study. This is an incident wherein a tiger cub was rescued from a 40-feet Gosi canal in Maharashtra. The tigress suffered spinal injury due to and leading to paraplegia. The tiger was shifted to WRTC for treatment and rehabilitation subsequently. The hope to revive a tiger in paraplegia due to spinal injuries is mostly guarded, as all we veterinarians know. The picture of bottom side will give you an idea to the canal that flows through the protected area. Similar, next please. We also get similar incidences in Gosi Canal. Tiger Jaichand also fell into canal and it was rescued by the forest department. A stag was also rescued from the canal by the forest department. So there have been other such incidences involving wildlife in the incidences regarding calling the animals in well or in canals. If there are no major injuries, I think we must think of immediate release than holding it unnecessarily, as done in case of Jaichand and this stag. Next, please. However, in the tiger which we are talking about, in this case, since the animal had paraplegia, it had to be brought to WRTC, then it was treated rationally, and the animal was provided supportive treatment. The tiger responded well to the treatment by day 9 and recovered completely by day 21. This tiger then was transferred to large enclosure subsequently, where it gained complete mobility. Of course, this could not be rehabilitated because of the problems of tigers in that area. Next, please. So the learnings from this is that golden hour is the first few hours, especially the spinal injuries. So from the time of incidence to the veterinary intervention, if we intervene at the early hours, this is the best chance. There is a best chance of treating this animal, and apt rescue and shifting of rehabilitation, shifting to the rehabilitation center may ensure the complete recovery. And as I again repeatedly stressing the importance of cages, improved cages can help in undertaking radiography without stress and need for anesthesia. At WRTC, still we are thinking of better cages for taking radiography, so that the animal need not have to be tranquilized just for the sake of taking a few radiographs. Next, please. Then in medicinal cases, few cases, detection and clinical management of Hepatogen canis in tiger. This was a very good case which we have come across. Wild animal diseases are least explored. Still, I feel that they are least explored area in veterinary science till today. And very little is known about the circulating infectious diseases, especially in free ranging. So there is a limited opportunity to monitor and survey diseases in wild, although few projects have been undertaken on this. Next, please. Hepatogen infection is common in domestic animals like dogs. However, in tigers, the disease is very rarely reported. It is an infection caused by ingestion of infested tick, mainly the Rhipicephalus and Amblyomma species. And the transmission is vertical, and mostly the transmission is self-limiting. However, the concurrent viral infection may aggravate the condition. And next, please. This tiger cub was rescued from Tadoba, and it was infested with ticks. And on blood smear examination, we found that it is infected with hepatozoon, and which is an intracellular parasite that is found in the form of gamont in the neutrophils. The infection was also confirmed by PCR. So that is what I'm saying, that the importance of diagnostic and going into the depth of the disease is nowadays is possible. The partial sequence have been submitted to NCBI database and has been allotted accession number as well. This tiger was treated rationally and recovered thereafter. Next, please. So this was treated with oxytetracycline and rational supportive therapy, and it took 30 long days for getting the infection totally negative. Next, please. So we personally feel that there is a huge knowledge gap still between the disease prevalence and diagnosis, and laboratory support is very, very important for better diagnosis, and molecular investigations are now providing vital insights into the disease diagnosis. So there is a need to bridge the gap between lesser known wildlife diseases, and we are attempting in that direction. Next, please. Another important disease is feline infectious peritonitis. We get a few cases of this also. As we know, this is caused by a coronavirus, a single-stranded RNA virus, and this is infectious and contagious, so can spread from one animal to the other. Fortunately, human transmission is not possible. There is beta strain, and majority of the findings, they include fever, anorexia, jaundice, and hepatomegaly. Again, this is a problem whether it's in captivity or free ranging. Diagnosis of this disease is very difficult. Many of the times we just see a pot-bellied animal and just animal is not taking food. So we are working on it, how to diagnose feline infectious peritonitis with some ultra-modern diagnostic kits. Next, please. So as per the study of WII at Dehradun, the infectious diseases lead to 16% mortality of all mortalities reported in tigers in our country. Thus, there is need to understand the diverse of diseases in wild, which is utmost essential to conserve the species. Next, please. Research in reproductive biology can be crucial in ex situ conservation breeding of tigers. A vaginal cytology study was undertaken by WRTC, and of course, it has also been done at Transit Treatment Center in Nagpur to understand the cyclicity of tigers and to find the right time to undertake breeding. So this is another area which we can explore for tiger conservation. Again, in webinars, it has been said that many of the tigers, once they come from wild into the captivity, they are never released. So we have good population of tigers, and captive breeding of tigers at some zoos is essential. We are requesting CZA for transfer of animals from one place to A place to B place, whether it's male or a female, but then procedure also takes a long time. So such interventions may help to us. That is what my personal feeling is. Next, please. Then another interesting case is blood transfusion in animals. Blood transfusion is a routine practice, as we know, in human beings. We have dedicated blood banks that facilitate blood transfusion as well. In pet animals also, now we have blood bank. We have such a blood bank at Mumbai Veterinary College. However, for thinking of blood transfusion in wild animals is very difficult, because in wildlife, the procurement of blood is critical, and there are many limitations to transfuse blood to a tiger. And again, there are a few issues of compatibility and ease of operation. However, at Maharaj Bagh Zoo, Nagpur, Dr. Bavaskar is again online. We have made an attempt to transfuse blood to a tiger cub, Zai, which had very low hemoglobin. This was attempted in 2008 and 9. The blood was collected from a tiger at Sanjay Gandhi National Park, Borivali, and then carried to Nagpur via air, and transfusion was undertaken at Maharaj Bagh Zoo. The cub could survive for about a month. However, it succumbed to feline infectious peritonitis subsequently. But this has given us a ray of hope that yes, even we can think of a blood transfusion in wild felids or any wild animal for that matter. Just we need to just channelize the procedure and think what best can be done to us to save a valuable animal if time comes. Next, please. Again, we talk of what to do with rescued animals. The rescued animal need to go in the natural habitat as early as possible. And all veterinarians, we are working in this direction. In Maharashtra also, we have got very good success stories. This is a Katla body tigress rescued and become a memento of successful veterinary intervention in tiger rescue in the state of Maharashtra. This tigress was found to be injured in a dry well. The tigress was rescued and treated, and after 6 or 7 days of care, the animal was released back in the wild on 14th February 2011. As Dr. Nigam said yesterday also, we need to keep this in mind, how long really we require that animal to be kept in captivity and how early can we release. This tigress has successfully delivered thrice since then, adding to the precious tiger population. So this is the first attempt and first successful release wherein we could track this tigress, and she delivered thrice, and she has added 9 or 10 cubs to our forest of Maharashtra. Next, please. Another important and matter of concern is road and train accidents. These figures you can see here, these are the figures which shows that we are losing precious animals with road and train accidents. Although we agree that development of infrastructure is a critical part of progress of our country, however, the infrastructure encroaching the protected areas often lead to accidents and mishaps leading to death of our precious wildlife. So we need to give a real rethought over these issues. Next, please. There is a tiger cub which had a similar automobile accident. Basically, 3 cubs with a tigress. They were crossing a railway line near Kelzar jungle of Chinchpalli range in Chandrapur district when it was hit by a train. The tigress and 2 cubs were hit by train. The tigress and a cub could escape. However, 1 cub died on the spot, and another cub that was badly injured. When we performed the physical examination, we found that it had a fracture of right femur. Then there were pelvic fractures also, and excess mobility at sacrococcygeal joint with a flaccid tail. So we undertook radiography. This is a pretty old story. So we had a conventional wet radiograph development modality. So we took the X-ray of that, and then we undertook the intramedullary pinning. So the surgical plan included only fixation of femur fracture and cage rest to take care of the rest fractures or dislocations. The tiger cub responded very well and the fracture healed normally. The remaining fractures did not require any special procedure, and this tiger could walk without depicting any defect in gait even on run. This tiger, after about 2 years, because it required a long care, and then subsequently it was with us for 2 years, and then is handed over to Sanjay Gandhi National Park, Borivali in 2014. Next slide, please. So these are the news articles. Next, please. So these are the news articles published in various newspapers regarding recovery of the case, and subsequently it was rehabilitated in Sanjay Gandhi National Park. Next, please. Now, the success is not always guaranteed in automobile accidents. This is a tiger which has been brought to WRTC Nagpur with history of automobile accident. This is very recent case. The radiographic examination, as you say, it reveals the fracture of forelimb that suffered comminuted fracture in the humerus extending into the elbow joint. The animal is now being managed conservatively considering the extent of damage and limited possibility of veterinary intervention in this particular case, because the fracture is at a quite a lower part and involving the elbow joint as well. And another case, Tiger Khali, you can see on the right side, extreme right side at the bottom. This is Tiger Khali, which has a spinal injury, very bad. It is in very bad shape, and such animals, we can't help it. We really feel sorry sometimes that for such animals we cannot do anything than just to manage these animals conservatively. So next, please. So based on our these cases, we have a few critical observations that majority of the accidents, the victims of accident, they suffer trauma and fractures, and often or mostly these are complicated and open fractures. Since we are talking about tigers today only, I have mentioned about tigers only, felids only. But in herbivores, the success rate is very slow or very low, I should say. And even in felids, if the fractures are open and commuted, then we have limitations in treating them. Head injuries and open wounds, they are critical for the survival of the tiger, so they are to be taken care. Next, please. Now, to intervene or not to intervene is a question. This is another case report from Maharashtra, wherein limited veterinary intervention led to a healing of the snare wound in tiger without the need for capture. Although, of course, this animal was captured. I'm not saying without capturing. I should say it was captured and released immediately. The decision whether the tigress needs to be kept in captivity for a longer period or to be released with just required intervention is very critical. And Dr. Nigam, who has treated this case along with Dr. Chetan and other vets, he has mentioned about this case in his yesterday's webinar, and they treated the case on the spot, and then the tiger was released back, and the decision to release this tiger back proved very, very correct, since after monitoring it was found that the wound healed quite nicely. So such animals should not go in, say, rescue center or in zoos for further treatment, but they can be treated on spot and can be released. But this decision has to be taken by the veterinarian in consultation with other team to whether such intervention is going to be helpful and immediate release is helpful for the betterment of animal. And if the answer is yes, definitely we should think of this. This whole entire operation was undertaken under the supervision of forest departments. I'm thankful to Dr. Ravi Kiran Govekar. This has been taken from his presentation. Next, please. Next slide, please. Now, from this, we can say that incidences of non-lethal snaring in protected areas, we can identify, and if the severity of wound is not significant, then the animal did not have to have kept in captivity for a long period. And sometimes the wound can heal on its own. So you have to monitor. If you feel that the snare is still there, of course, you have to remove the snare, do the dressing, and immediately release the animal as early as possible. Next, please. Similar case, this is a Moharli tiger. This is a case in 2012. This is a case of an eye injury. Now, inter or intra-species conflicts can lead to such lethal outcomes. Eye injury in tiger, this is treated with surgical intervention, and the animal was released on third day in wild. The animal survived and recovered uneventfully. So, which we should have always such approach. If the animal has an injury, whether we can immediately release the animal after being intervened. Next, please. Then hand rearing of felid cubs, especially tiger cubs, at WRTC or let it be in Maharashtra Zoo, we get quite a number of tiger cubs for hand rearing because of some or the other reasons they are handed over. And orphan tigers, they need care and support once they are separated from their mother. Hand rearing tigers involve feeding and healthcare in captivity. These pictures are from Maharaj Bagh Zoo. We at our WRTC also regularly receive young ones of variety of wildlife, including felids, and we have standardized the protocols for hand release also for different species. Next, please. Now, hunting and poaching incidences, another thing wherein veterinary intervention is required. Let it be for diagnosing the cases, let it be for postmortem examinations, or let it be for treatment if it is required. So poaching is a great threat to the species under tremendous pressure. There is a need to investigate and collect evidences, and this is a basic responsibility of veterinarian to shoulder. Next, please. Postmortem examination. It is a very critical in finding the causes of death in tigers, and we play an important role in collection of evidences in the field. Wildlife forensic is also now developing quite nicely. So I'm happy in that way, and we have a major role to play in wildlife forensics as well. Next, please. This is a case wherein unfortunately the tiger died because of snaring. The wire snare can be seen embedded in the neck region of the tiger and ultimately resulting in death of tiger. So this is very unfortunate. But still, nevertheless, although animal has died, it is very important from the point of view of diagnostics and then taking preventive measures for preventing poachings, identifying the culprits and booking the culprits. Next, please. This is another example where we were just called to for performing postmortem examination putrefied carcass of tiger. It was also a result of poaching. Next, please. So, from our experiences at Wildlife Research and Training Center, coming to the core of the webinar, based on the experiences that we have gained with our engagement with tigers, we have identified some critical points for tiger conservation. Next, please. The biggest driver of tiger conservation in our country is presence of social, political, and legal will in the country to conserve the tiger. So this is the best, greatest strength I feel that we have. Then it is depicted as well with with the increase in tiger population in the country over the period from 2014 to 2019, and I'm sure now as on today also. Trained manpower is again our strength. I recall the days when we were veterinary students. We just, when I was posted in Maharaj Bagh Zoo also, we had very few books. Of course, internet or Google Baba was not there during those days. Whatever experience or training we had got, whatever experiences of seniors are there, we used to call them. Again, mobile was a luxury or it was not available also. So we had to call them telephonically and ask for the treatment, and accordingly we trained ourselves. Fortunately, nowadays we have much better facilities than earlier days. We have got a good team of veterinarians, not only in Maharashtra, but overall, if we see the scenario, everywhere we have trained manpower, and availability of basic facilities for veterinary intervention is also improved a lot. I remember that when we were working in our earlier days, we just had say chain link fences, gunny bags, and very few scientific equipments to deal with such casualties and for veterinary interventions for treating old cages we had from which it was very difficult to treat. Now with increasing technology, basic facilities have definitely improved, and WRTC is the best example. We are now even will be having more equipments, endoscopies and laparoscopies also will be available very soon. So basically treatment facilities as well as research facilities, they are available now. So this is also one of the good thing, good sign. Then availability of funds and resources, comparatively, definitely they are better now as compared to what it was in say early 70s, 80s or 90s, means before we started our career, but what we refer to when we see the literature. Then rapid response team in protected areas. This is one of the good initiatives taken by the forest department. I really congratulate forest department for this, that rapid response teams are formulated and forest department is taking care. They have now the vans, they have the good cages, and they have good, they have nurtured good veterinarians also. So we should always see this positive thing, that veterinary science has also progressed quite a lot because of the inputs given by the forest department. And of course, communication is the best strength. Nowadays, we are just say few seconds apart. We can have communication with the expertise, and we can always get the advices, the videos, through the videos, pictures, and lot of material. I remember for doses, I used to carry the doses in a written format in my pocket diary, so that if any chance comes, if I need to go for a rescue, I should be knowing the exact dose, what dose I need to give for the animals. But now with the communication, this has become very easier, and we are fortunate now. So this is the strength of wildlife means veterinarians, and we can play a major role in conservation. Next slide, please. Now, if we talk about weaknesses, strength of veterinary staff in protected areas and zoos is still less. Although I have said we have good teams and all in our strength, but still it needs to be addressed. Yesterday also this topic was discussed, and I also personally feel that veterinary staff in protected areas and zoos they need to be increased. Still, there is non-availability of laboratory support at many of the places. Although few of the laboratories are good, working nicely, few zoos or few institutions have the laboratory support. Still, in the field, it is lacking. So I feel that such support is very essential, and especially in protected areas, this logistic support is required. Availability of drugs is again another weakness because it is not readily available. So we have to keep these drugs in custody all the time. Drugs are costly and many a times may go west because of expiry dates. So availability of drugs should be addressed in a holistic view. And permanent veterinary cadre in wildlife. This is a very burning topic. All veterinarians, young veterinarians who have they are very enthusiastic and doing really nice work in the field. However, many of them are working on temporary business, temporary post. And so forest department, I urge the forest department as well as the stakeholders, government maybe, that they should think of having permanent veterinary cadre in wildlife. Train response team, as in a few places we have rapid response team, but in many of the areas still it is lacking. So we can have a network wherein we can help each other, and rapid response team can be built up. Skill development program for wildlife veterinarians. When we started our career as wildlife veterinarians, there were hardly few programs conducted by WII or CZA, and those were the opportunities for us. But field veterinarians will agree that if there is a say training program, and if there is some animal ailing or sick in his zoo, he cannot move from the play park. So he loses that opportunity of undergoing through the training. So skill development program for wildlife vets on a regular basis should be thought of. This is a weakness as on today. And considering this at Wildlife Research and Training Center, we have been planning this, that we will be having continuous educational programs as done at WII also. So skill development programs in Maharashtra, we are planning through WRTC. And I'm sure that in coming days, we will have a good team and good facilities to have such programs. Of course, on a short term basis, we have already started few, but we would like to offer these facility for more and more budding veterinarians. Now, regarding research gap, there is a lot of research gap and funding, and more inputs are required. Basically, the Wildlife Protection Act that prohibits many of the research which a veterinarian wishes to conduct, because there is a procedure. You need to take permission from the forest authorities, and so there is a hindrance in research. We can, in domestic animals, we can start doing research. We can, whatever parameters we want to study, we can immediately study them. But in wildlife, we require such permissions, and there is a research gap. The research institute do not get the research material, the biological material, whereas the forest department doesn't get the research institutes. So I really appreciate the decision of the government of Maharashtra to establish a wildlife research center, the WRTC, in the state of Maharashtra. And this is unique in the sense that we have live animals. So we have rescued animals with us. We are helping the forest department and FDCM for treating these cases. So they are benefited. Simultaneously, we are benefited in that that WRTC has already started training for veterinarians. The internship batch, they are regularly coming. As I said, my batch was the first batch to get internship of 8 days only. But 8 days getting training in wildlife is very insufficient. But now we are keeping the intern students more, not only from Nagpur Veterinary College, but from veterinary colleges of other colleges from the state. And now with the VCI deciding that internship batch from student from A state can go to B state, now we also receive the student from neighboring states. So it's a very good facility created by the government, the FDCM and MAPSU. So I'm thankful to FDCM and the MAPSU authority also. So we would be conducting need-based research. Already we have started doing basic research in wildlife, but more funds are required. That is what I feel. Next, please. So again, as I say, the threat, opportunities, the weakness and strength, they are always overlapping. So development if we consider opportunities now in wildlife health, development of transit treatment center at may not be at district level, but at least in the areas, in each district, in the areas where considerable wildlife population is there. I can give best example of transit treatment center of Nagpur. It is doing excellent. Today also, when we are sitting for a webinar here, there is um, a leopard roaming inside the crowded area in Nagpur city, and the TTC team is after catching the leopard. So having transit treatment centers at a area in remote areas, I'm not talking only about Nagpur, but in remote areas where there is considerable population, definitely we can develop such centers that will pave a way in saving the precious wildlife. Then strengthening of infrastructure facilities for treatment, transport of tigers and other wildlife. As I have shown in the at WRTC, we can think of strengthening the infrastructure facilities in the protected areas as well. Development of skilled manpower involved in wildlife conservation. So through regular trainings, that is also a good opportunity which we are trying to explore. And disease investigation laboratory for wildlife, which is much needed, and forensic laboratory also we have submitted a proposal to the government, and I'm hopeful that even a forensic laboratory will be developed soon in the state and hopefully at Nagpur. Then development of a channel for supply and monitoring of drugs at state and national level. This is also very important. And regarding rewilding of orphan cubs, we should think of developing some protocols. We have made a few attempts also in Maharashtra. Some of them are successful, some of them are not. But on regular basis, can we do this? So this is a big opportunity for us. Next, please. There are few threats also, increasing tiger-human conflicts. Many of the times we are watching on channels, we are reading in newspapers that the conflicts are increasing. In Maharashtra, we have this problem. Our PCC, Honorable PCCF has also expressed yesterday that tiger population is increasing, and so also the conflict increases. Lack of corridors for spillover and migration of tigers is a threat. Of course, the policymakers should think of this, and veterinarian cannot do much in this. Outbreak of infectious diseases in protected areas that needs to be addressed in a proper and holistic view. Declining prey base in protected areas is another threat, and I think that needs to be addressed in a holistic view. And tigers straying out of the protected areas in search of prey and mate. As I said, leopard is common, but even tigers are also straying out. And poaching and hunting, I should be saying that it is under check, but still needs more monitoring and more emphasis. Next, please. So with this, I would like to conclude by saying that veterinarians are committed and we play a key role in wildlife conservation. So with this, I conclude. I thank the organizers for opportunity to express my views at this auspicious gathering. It was an honor to be part of this program. Thank you very much.
The topic is open for discussion.
Hello.
Yeah.
Am I audible, sir?
Yeah.
Yeah.
Go ahead, please.
Sir, I am Mayur Kate from Transit Treatment Center, Nagpur. So, sir, basically, I have one question. We regularly get every animals, means every animals, let it be mammals, reptiles, or birds. So we generally come across the fractures cases, and especially spinal injuries or dislocation.
Yeah.
We have poor prognosis. So, tackle such as wherein you know that animal is not going to survive. So please guide us about it, sir.
Yeah. In my presentation already, as I said, rail and train accidents or automobile accidents is very common, And many of the animal species we get at our transit treatment center or rescue center for treatment, they are in a bad shape. But still we have a ray of hope, as I have presented a few cases wherein we could successfully revive the animal and we could then. I agree that such animals may not go for rewilding because of the major problem they have suffered. But as far as the issues of spinal injuries, wherein the tiger or the animal is in pain, and as a veterinarian, we also know that prognosis is not good. Say spinal injuries, spinal fractures, dislocations. So although animal is not going to survive, presently we have such an animal in our rescue center. The tiger Khali is suffering from spinal injuries and possible fractures also. He is in such a bad shape. Just we are managing the tiger conservatively, and we are taking care that he has minimum pains. And for in case of domestic animals, we think of putting the animal down, euthanasia or the mercy to the animal. But in such cases, especially in wildlife, I personally feel that as on today, we do not have such avenue. So as a veterinarian, we should try to save the life of animal, let the animal be in rescue center forever. I'm not saying that the animal needs to be get mercy at every time. But if say the story of Saheb Rao lost the limb, but he's our pride. So we attempted say prosthesis in that animal. We are also using Saheb Rao for breeding purpose, although maybe in captivity. So if such animal we can preserve and save, definitely it is good. But for the animals which are not going to recover, just keeping the animal at ease without much pain and managing conservatively on medicine is the only answer as and now. We cannot put the animal to sleep as far as today's rules are concerned. But I feel personally that such an issue needs to be addressed. Yesterday also, I think there was a discussion on this. So I request the WII authorities and Forest Department to think in this direction as well, because it is very valid question, I feel.
Yes, sir. Thank you, sir.
Sir, it was a wonderful presentation, sir. It was very enlightening to see how good work is done. So, since Parag was also there, in continuation with what Parag sir was highlighting, flagging a very serious issue of euthanasia, I do understand and agree with my colleagues there at the decision level when they tell it's grave, and because of the existing rules, we can't put the tiger to sleep. Since Sonali madam also there, Parag sir also there.
Yeah.
So we should come out with the guidelines, not just because what do you mean by managing conservation? Conservationally, I don't understand, but I think we are just run by emotions, not thinking from the welfare point of a tiger which has not a limb or has a spinal injury. I've seen many cases in my own experience. So when we raise this issue, unless there is some guidelines from the NTCA or the CZA, this is going to be a everyday's star story. So I would like Sonali Madam and Parag Nigam to comment on this along with the presenter. Thank you.
Yes, I would like to also add that in such cases, the press media, what they feel is, as a veterinarian, we know that we are helpless in this case. We cannot do much in this case. But press media, they feel that nothing is being done. This is what the agony is. So if Dr. Parag Nigam is online, again, he can talk or say a few words, or anybody else, I think. It's a very valid issue.
No, I request Parag sir and both Madam also is there. So it's the right platform to come out some concrete plans than just discussing in the webinar and going, because it's a matter of concern. Thank you.
Yeah, so a very good.
I think we are losing him. Okay, he may join. Any other question?
Hello, sir. Can you hear me?
Yeah.
Sir, I'm K. Pathan from Hingagar, Maharashtra.
Yeah.
Sir, I need, in your opinion, what is the future of wildlife veterinary, and do the young generation at present young generation aware of this field?
discussion.
We are not audible.
The future of wildlife veterinarian. I think you are asking what is the future of wildlife veterinarian, the youngsters who are taking education, right?
Yes, sir.
So definitely that is what we have been stressing. One point is that again I would like to go back in those days where the wildlife veterinarians were not there. So basically, some livestock development officer or veterinarian who is engaged in treatment of domestic animals was deputed to the wildlife wing. Our Dr. Kholkute is also online. He was such a person who was deputed from the LDO's post to the field. Now he excelled in his duties. He worked in wildlife for a pretty long period, contributed enormously. But usually what happens is such LDOs, they are posted for a year or two, and then they are again repatriated back to their parent department, and some other veterinary officer is posted who doesn't have experience in wildlife. So now time has come to develop a strategy wherein the wildlife veterinarians, we have a large number of wildlife veterinarians who are working on temporary positions, and maybe because of their age bar, maybe because of some or the other reason, then they leave this profession, they go somewhere else, and then again forest department invites, or forest department had to borrow the services of field veterinarians who are basically doing, or they have done their job mostly in domestic animals. So time has come, and I think the department has also taken this issue seriously. About 2-3 years back, the forest department has even created 11 or 12, 13 posts for veterinarians. So definitely veterinarians do have a very good future and career, and not only in Maharashtra, throughout the country as such. But I think veterinary institutions who have some say in this should put these things on the platform, appropriate platform, and wildlife veterinary wing should be a separate wing wherein the expertise will be available, because in wildlife, as we know, we do not get the knowledge in 1 or 2 or 3 years. So it's a pretty long procedure, and with every single case which come across, we get the experience. So once such experienced person we have, we should not lose these, such veterinarians, and we should think of accommodating these veterinarians into the cadre. And it is possible when we will have a separate wildlife veterinary cadre. And number of these posts should also increase. And I'm sure, Dr. Pathan, I think you are doing veterinary course, or you have completed it, might be.
Sir, I'm a
You
student.
have
I'm a
completed.
student. Sir,
Okay.
actually, I'm a student
So
from BSc.
PVC. Okay, fine, good. So definitely there is a great future. In coming 2 or 3 years, you'll find that the cadre of veterinarian, wildlife veterinarian is built up in the state of Maharashtra. So all the best, please continue. Your interest in wildlife.
Okay, thank you, sir.
Thank you so much,
As
sir.
we are running short of time, we will continue with our program. If any queries are there, you can email us at directorwrtc@gmail.com. I will repeat it again. You can email us at directorwrtc@gmail.com. Thank you, sir, for that wonderful and brainstorming talk on a very unconventional topic. We are the witnesses of your contribution in WRTC Gorera Nagpur. We appreciate your upright opinion on the subject. On behalf of organizers, I extend my most sincere thanks for a wonderful talk. Thank you, sir.
Thank you.